is hosting today's event. Science for Democracy was founded 5 years ago to promote what we call the right to science, that is the enjoyment of scientific progress and its applications, fostering a dialogue between the scientific community and decision makers nationally and internationally. You can find more information about this on our website at sciencefordemocracy.org. Today's webinar, organized a few days before the 20th Congress of the Associazione Luca Coscioni, will continue the work that we have been carrying out over the last few years to allow the sharing of information and updates on researches and psychedelics and their possible medical and psychotherapeutic use. As we all know, those plants and molecules are under international control, a control that in some parts of the world has become an outright prohibition. We're happy to have as guests today speakers that work in parts of the world where, not without problems, research has been progressing and where trials are ongoing, so that soon some of the molecules that we will discuss today might soon be recognized by regulatory agencies as medicines. After our speakers from Canada and the United States, we will also hear what's going on in Europe and what are the plans for future activities that will involve civil society as proponents of reforms. I will be able to stay with you for the first part of the webinar. After me, Marco Perduca of the Associazione Luca Coscioni and board members of Science for Democracy will take my place. Okay. So thank you so much again for being here. I'm going to leave the floor very soon to our first speaker. Our first speaker is Dr. Reid Robinson, MD, MBA, Numizon Chief Clinical Officer, who will speak about psychedelic therapies, tracing their historical context, presenting current medication and treatments. He will emphasize the role of set and settings and explain the standard therapeutic models in use. Thank you so much again for being here with us.
All right, it's good to be with you today. My name is Reid Robinson. I'm a psychiatrist as well, based in the United States in Utah, and I oversee our clinical work in mental health, working with traditional mental health treatments and ketamine and esketamine, and also participate in psychedelic clinical trials. We are currently doing studies with psilocybin, just completed an LSD study, and just this week are starting a study with 5-MeO DMT for depression. So it's an exciting time to be in this work. And a lot has happened in the past several years, but looking back even further, I think many of us are familiar with the history and the unfortunate ban on psychedelics that took research away for quite some time. But then around the year 2000, psilocybin research came back. And now, if you look at this year alone, we have phase 3 results from MAPS using MDMA for PTSD that are very promising. We are participating in phase 3 study with Compass using psilocybin for treatment-resistant depression. And if things go well in that study, we will presumably have psilocybin available as a treatment option in clinic within the next couple of years. And so how I got into this work was I started my career at the University of Utah doing clinical trials, looking for new medicines in psychiatry. I was getting more and more discouraged with what was available and the treatment responses. So it was around 2010, I was asked to do a study of ketamine for TRD, treatment-resistant depression. And I was just very fascinated by not only the rapid antidepressant response rate, like overnight improvements in the majority of individuals, but also this state of consciousness that came about when you gave this medicine, like with classic psychedelics, was really intriguing to me. And I got really curious about what we could do with that to deepen or prolong the therapeutic benefits. And so this is data from that study that I was involved in back then, showing a couple different treatment regimens with ketamine and how quickly some of the antidepressant responses kick in. And in our clinics, I wanted to point out that ketamine compared to the classic psychedelics has been mostly studied as a medication intervention. So I put 3 different ways we work with ketamine in our clinics, and this applies to many out there. So there is psychedelic assisted psychotherapy, or with ketamine, we call it ketamine assisted psychotherapy, where we do preparation sessions to get the client ready. On dosing day, they come in, we work with them to set an intention, give them eye shades, headphones, hold space for them while they have an experience with this medicine. And then we talk about it after. They come back the next day for integration, maybe the next week. Maybe we'll do another dosing session according to the individualized treatment plan. And then we also use ketamine and esketamine as a medication sometimes because of its antidepressant response and rapid onset. So when esketamine was approved, Spravato brand name, we adopted that in our clinics, and we'll give it over 7,000 doses in our US clinics this year for people with TRD. And it's been such a great option to have in the toolkit for people who are struggling, and especially those where traditional treatments didn't help them as much as they needed. And so this is the overall structure of psychedelic therapy that I was talking about, where preparation, 1 or usually more preparation sessions to help the client understand what to expect and help them set intentions and point the direction of their work in an optimal place for them. And then a number of dosing sessions in the psychedelic trials, like in the MAPS MDMA studies. This is typically 3 dosing sessions. In our psilocybin studies, this traditionally has been 1 or 2 dosing sessions, and there has always been integration or psychotherapeutic support in between dosing sessions in these protocols. So I'll just highlight a few studies in this modern renaissance that have really kind of paved the way for the potential approval that's coming up. First of all, with psilocybin, early on, Roland Griffiths and colleagues at Hopkins did psilocybin studies for end-of-life anxiety, and saw 80% of patients with life-threatening cancer had very significant reductions in anxiety, still present after a single dose months later. In a depression study at NYU by Ross and colleagues, over 80% had significantly reduced depressive symptoms after a dose of psilocybin therapy. And these are a couple of the big ones that have come out. The Compass phase 2 study that was done previously, now we're in the phase 3, looked at over 200 adults with TRD and gave a single dose of psilocybin, and the high dose, the 25 milligram, had superior response and sustained response. And keep in mind, this is a non-daily pill. This is 1 dose with psychological support. And to me, as a psychiatrist, this is really exciting and meaningful to be able to approach such a difficult to treat condition this way. And this is a study that we were also involved in that was just published within the last few months. Phase 2 study with Usona for MDD, over 100 participants, and 1 dosing session, significant improvements in depression, again, sustained in many at 6 weeks out. And then it's worth mentioning, of course, the MDMA data that has come out. MAPS has now published their full phase 3 study results. This is just a graphic from the first part of that data, but the rest of the data looks similar. And what strikes me, again, as a treating clinician, is that for something where we did not have very good tools previously, to see 67% of people with severe chronic PTSD go through this course of treatment and no longer meet criteria for the diagnosis is game changing. This is really has the potential to help so many people who are suffering with this condition. And MDMA is really a unique medicine. I don't know anything that works quite like it in creating this state of safety where one is able to move towards the trauma that they previously, understandably, just had to flee from. It was too difficult to confront. And we see in brain imaging studies too that the amygdala alarm bells are toned down, coinciding with or showing some of the mechanism of this. And so how do these things work? We just looked at a little bit of the MDMA mechanism, but if you're looking at psilocybin, for example, or classic psychedelics, there's one theory that I think sums it up pretty well by Carhart Harris and colleagues, done out of Imperial, called REBUS, or Relaxed Beliefs Under Psychedelics. And with this idea or the analogy that psychedelics kind of heat up the brain, not literally, but increase plasticity in the brain and weaken the influence of these tightly held thought patterns, ruminating, depressive thinking patterns, and over control patterns in, say, an eating disorder, OCD, or addiction. And as it becomes malleable, in that window of malleability or neuroplasticity, we can do deep therapeutic work. The brain receives these interventions better. And as that window closes, or as the brain cools, if you will, this set of beliefs, rules, restrictions, and patterns reshape. So we can consciously shape the patterns and end up with some lasting change. And so to summarize, psychedelics kind of relax the weight of these strong top-down, tightly held beliefs, and then they reconnect you with the sensory inputs and help you use that real world data more to make decisions in real time rather than defaulting to these maladaptive patterns. And this comes out of Gould Dolan's lab that she published earlier this year, looking at the window of neuroplasticity, or what she calls critical learning, critical social learning, that opens up after psychedelics, classic psychedelics, and ketamine, MDMA. And interestingly, it correlates with the half-life of the medicine, but it shows one theory of why we do these integration sessions in a time window after the dosing sessions to try and maximize the therapeutic benefit. And then one other kind of mechanistic thought that I find interesting as a psychiatrist is that when you give an SSRI, even though it targets a serotonin receptor, a different one, but the serotonin system as one of the ways it's thought to work, it's more like you're putting your emotional system in a cast for a time, which can be extremely helpful and useful as a temporary measure to help get someone to the other side of a very, very difficult episode. But there is some, say, emotional blunting or reduced limbic responsiveness that can result, among other side effects, when you give psychedelics. Even though it can be a difficult experience during, you have this embodiment, this enhanced sensitivity, this emotional release. And when you combine that with the right psychological support, you can see how it becomes a recipe for lasting change and moving through the areas that need work rather than kind of keeping them at bay for a time, and getting more to the root of what's going on, if you will. So I think in just to mention here, a dose finding study at Johns Hopkins by Griffiths and colleagues showed a correlation with dose. Like the higher the dose, the more likely they were to occasion a mystical experience in participants. And the dose also increased the the chance of having a difficult experience. But what's interesting is when you combine a mystical experience like this non-ordinary state of consciousness where you connect with something bigger than yourself, and you combine it with an emotional breakthrough, like facing something difficult and getting to the other side, that's where we're seeing, in general, more lasting positive transformation. So these are some of the things that we'll measure in our clinical work with ketamine and other medicines, and in research studies to try and understand like the role of the psychedelic experience, the role of the challenging work. And so I'll leave my overview at that. I wanted to make sure there's time for everyone else's remarks. Looking forward to hearing what's coming next. But I've really, since that first ketamine study in 2010, really dove in and feel strongly that these are important avenues to pursue for mental health and for the people we work with. And it's a path we can't afford to ignore. And I'm happy to see that this train has not only left the station, but approvals are imminent, and we are doing work in clinic with the medicines that are available, like ketamine, esketamine, and doing research studies to help pave the way for this next chapter. But thank you for listening.
Thank you, Reid. I'll take over from Laura, who's at the hospital working, or maybe you want to take it. Okay. I think getting to a station may be an easy trip, but it may also be a complicated exercise, and perhaps rules, regulations, and obstacles imposed by decision makers or politicians can be a problem. So we're very happy to welcome Sharon Sidhu, who's Nominus Vice President, Scientific Research and Innovation, and she will speak about the regulatory landscape of psychedelic therapies in the US and Canada, offering insights into the legal challenges and advancements in both countries, and additional details in Canada as it pertains to psychedelic assisted therapies. I think the regulation for us is very important. We will hear later today on what is happening in Europe. Europe tends to copy what happens in North America, so we are happy that someone has taken the leadership also on this kind of complicated issues. Sharon, you have the video. You're muted, I think. Yes.
Yeah. Good morning. How's everybody? Thank you for having me and inviting us this morning to participate in this conference. I look after the scientific innovation at Numinus, working at the lab Numinus Bioscience, but I also look after the regulatory compliance work at Numinus, specifically related to clinical trials, compliance with our clinics, and compliance with a special access program, which is access to these medicines whilst they're going through regulatory approval. So in Canada, we work with Health Canada, and Health Canada for narcotic products, whether they are considered therapeutic or not therapeutic, fall under controlled substances and the cannabis branch. Because these products are under Schedule 1 of the narcotic regulations, we have to abide by the rules that are implied through the controlled substances and cannabis branch. So we held a controlled drugs and substances license, which allows us to conduct activities such as research, activities such as analytical testing, development of products, and anything that we are able to do under this license will go into the development of clinical products, which then fall under the Health Canada Health Products and Food branch, specifically Division 5. And they take care of all the clinical trial applications and submissions under the Therapeutics Products Directorate and Office of Clinical Trials, which eventually get approved and then are under the purview of the Marketed Health Products, which is Division 8 of the Health Products and Food branch, as well as Regulatory Operations and Enforcement branch. So there are two separate streams for narcotics and narcotic regulations. One of them, like I said, is controlled substances and cannabis branch, and then crossing over into health products and food branch once these products become regulated under drugs and therapeutics. Now, the Office of Controlled Substances also looks after exemptions. So the exemptions permit products to be used that are not under a regulatory stream. So typically they would be used for research. So initially in Canada, people were able to access psilocybin mushrooms for therapeutic use and end of use distress under exemptions, which were controlled by the Office of Controlled Substances. Now, what this did was allow a small group of people to access these medications under ministry approval. However, in the last year, Health Canada did remove that permit through the Office of Controlled Substances and Exemptions and moved it to health products and food branch under a process called Special Access Program. And I'm sure Evan, who's speaking next, will go into more detail about that. What the Special Access Program does is it allows products that had not gone through a regulatory approval process in Canada, being issued a drug identification number to be used for therapeutic purposes under practitioner supervision. This has been quite successful in Canada, allowing people to access psilocybin and MDMA for therapeutic purposes. The process is quite lengthy. However, it has been successful in the interim until we see regulatory approvals for MDMA and psilocybin, MDMA being the one that's going to be approved shortly in the next few years, hopefully. Okay, and in the US, I can go to my next slide. In the US, we see a different regulatory landscape. We see the Department of Health and Human Services and Food and Drugs Administration, essentially the FDA, which looks after the regulatory approvals for new drugs. And that process in the US and in Canada is pretty similar as far as the approvals for drug products go. Narcotics, however, and the substances that we're talking about, MDMA, psilocybin, LSD, are still under the Drug Enforcement Administration. So any approvals for research for clinical trials would also have to go through the United States Drug Enforcement Administration. So a little less, a few less offices involved, but a lot of the work that's done in Canada under different directorates are done under the DEA, the Drug Enforcement Agency in the US, and the regulatory approvals for drug products would still have to go under the FDA, which I'm sure everybody here is familiar with. Now, the complication in the US, however, is that each state has its own ability to regulate some of the substances that they're working with. And there has been a lot of changes and discussion on psilocybin, specifically psilocybe species and psilocybe mushrooms, and decriminalization and regulations for the use in a therapeutic context. So here, this map actually comes from Psychedelic Alpha. It is interactive, so you can actually go in and look at what each state has done in the US. So here in red, we have the legalization and existence of regulatory statute. We have states that have decriminalization, reduced penalties, and then local government reform. So basically evolving regulations in states. This is different from what happens at the FDA level. The FDA level and the DEA level, what we're looking at is a federal oversight on drug product approval. So what MDMA is going through right now with MAPS. Now, that is taken care of at a federal level. What we're seeing at a state level is local rules and regulations that would govern access and would govern therapeutic protocols and would govern how these products are administered, how they are manufactured, how they are tested. So it's pretty much like how cannabis is still being implemented in the US. Now we're obviously seeing changes with cannabis at the federal level, but at the state level, each product is governed on its own cognizance at the state level rules. The complication in that is that there is no federal oversight, and these products aren't considered drug products. So the practitioners in the state implement these regulations based on the evidence that they have, and the federal regulations are based on clinical trials and clinical evidence and the approval of drug products. It's where they will coincide is when we have things like MDMA and psilocybin, once they actually get approved, would not fall into the same state regulations. They would fall into a different category of being prescribed by practitioners under the federal regulations. So those are the two avenues in the US, being federal and state. And then in Canada, we have only the one access point right now, which is going through drug approval processes with Health Canada, and SAP, which is a temporary solution to access of products through a special access program. Again, that is done on a practitioner basis and through practitioner recommendation through a special application process instigated by a said practitioner. That's all I have. So if you have any questions, I think we have questions at the end of the session. Thank you.
Thank you, Sharon. Yes, indeed. There, as you can see, I'm talking to the 100 plus people that are following us here in Zoom and also on other social media channels. There is a possibility to pose questions. Our speakers will be with us until at least 1900 hours Central European times. The next speaker is Dr. Evans Lewis, who's Numinous Vice President, Psychedelic and Neurology. And I'm not summing up what he's going to talk about because he can do it by himself, but we are very happy to have this first Canadian presentation and that also has already touched upon what is going on with the US, and then Federico Menapaccio from MAPS will take on the rest of the updates. One little thing while listening to what Sharon was telling us is that Europe has I would say quite a different kind of regulatory system, and it's a little more bureaucratic if you want, and we will hear from Tadeo later on what are the needs and constraints for groups. Here more than the private sector, there is a coalition coming, including also civil society organization that is trying to push this ahead, also with members of the European Parliament, but we envy the regulatory system that is in place in North America. Evan, you have the floor.
Thank you, Marco. So, hi everybody. So I'm Evan Lewis. I'm a neurologist. I have expertise in pediatric epilepsy and pediatric neurology, and have a very keen interest on the implementation of psychedelics in the field of neurology. And that's one of my main roles at Numinous as the Vice President of Psychedelic Neurology. I also am the Medical Director of the clinic in Toronto, Canada. And in addition, sono felice di essere qui oggi. Abitavo a Lanciano molti anni fa e mi manca molto l'Italia. Grazie a tutti. And I wish I could do this more in Italian, but it's been a very long time. And I don't know if I know any of the words related to psychedelics in Italian. So it's something I'll have to learn. But happy to be here. So grazie ancora e cominciamo. And the topic today that I'm going to talk about is functional neurological disorder. So this is a really interesting condition I'm going to share with all of you and introduce it to some of you. Perhaps you know this as another word and another disorder. And the key here is I really do believe that FND is the segue of psychedelics into the field of neurology, amongst many other applications. So we're going to focus a little bit on this, but the overall idea that I want to share with all of you is that there are other applications outside of the traditional ones that we've seen that have been researched over the last 10 to 20 years, which makes psychedelics a really exciting area in other areas, in other fields of medicine, including neurology. So psychedelics overall, as mentioned, they have this transdiagnostic application. They seem to work in several different conditions. And, this is rare in medicine. Often when these things have arrived in medicine, there's been a lot of doubt and they've been cast aside and disproven. But if you look at what is the main central idea amongst these disorders specifically? Well, when you dig down deep, they're actually disorders of how the brain is networked. They're not localized to just one area of the brain. It's really how the brain is working as a whole. And Reid pointed to this in some of the models, and we're going to talk about the mechanisms. And by approaching it in this way, you can really have a good understanding of how psychedelics work and why they might work elsewhere. So here is a really nice framework to think about psychedelics. There's three main levels that psychedelics act on. They act at the molecular level to create certain molecular changes that you can look into. There's a lot of work on this. Reid mentioned some of these that work that ultimately translate up to the level of networks. And at the level of networks, what you're doing with those molecular changes is you're altering the ways in which the neurons are communicating with each other. And by altering the ways the neurons communicate with each other, you're going to alter how the neurons speak as groups and populations throughout the brain. And when that happens, that translates up to a third level, being the psychological level, or the way that we perceive the world externally, how the way we perceive our own selves, our own bodies, etc. So the focus today is really going to be at this level 2, at the network level, that I'm going to walk you through very briefly. So many people who are in the psychedelic space are familiar with this particular study or have seen this image before. It's been made quite famous by Michael Pollan in his book, How to Change Your Mind. It's quite an oversimplification of what the study actually did, but in large part you can see that this graphic here is representing network connections in the brain, and you can see a placebo versus psilocybin. When the brain is exposed to psilocybin, it becomes much more interconnected, much more rich in its connections. So another way to look at this is that psychedelics really are brain network medicine. That's the idea. That's where it kind of localizes to overall. And what they ultimately do is they work to increase the number of states that our brain can shift through. And our brain is always shifting through states. Right now, your brain is in a certain state as it's paying attention to me, focusing on the words. But if something was to make a loud crash outside, you would quickly attend to that, and that would shift your brain state. So that is a relationship to cognitive flexibility. And one way that's illustrated this nicely was in this paper by Dawes in 2022, where they looked at the landscape of someone with depression as being very deep wells and high walls that were difficult to move through. So this is representative of the brain here in these deep crevices that it's hard to get out of or move into other components. And then what happens under the influence of psilocybin, it kind of flattens that landscape. And as the landscape is flattened and then built back up thereafter, you see that this relaxed landscape, which translates to relaxed networks, is much more easily traversed. And that's the key here really with what psychedelics are doing overall. And one way to frame it, I think Reid mentioned that it's kind of melting, and that's what you can see here, heating up, and that's what you can see in kind of reforms over there. Okay, so quickly we're going to take a turn into FND, or functional neurological disorder. So what is functional neurological disorder? What it is disruption in how the nervous system is functioning. There's actually DSM-5 criteria for this because it was previously known, or still is known, as conversion disorder, psychosomatic disorder, somatoform disorder. Freud coined this as hysteria back in the day. And really what it is, it's kind of any change that could happen. Literally, functional neurological disorder can manifest as anything. And when it manifests, what we see as a neurologist or as a physician is that the findings we're seeing are not compatible with any kind of condition we know. So, and then we do MRIs or other kind of objective testing, and all of that tends to be normal. And that's because it's a problem with the software in the brain. That's another way to think about it. It's a software problem with the functioning of the nervous system, not essentially a problem with the hardware. So right into some examples of this, this has been around for a long time. There's many historical accounts. This is, you can get this from the London Screen Archives. This is footage from post-World War I, soldiers coming back with shell shock. And you can see an individual like this with an exaggerated limp. Now, as a neurologist, you would look at this and you would know that that's not a proper limp that would be due to a structural neurological problem in the legs or the nerves of the spinal cord. And then you see this individual, I'm going to fast forward it a little bit, goes in for treatment. These treatments you can read about, and there he is kind of walking normally immediately afterwards, right? So we see this today. We see this quite a lot. As a neurologist, this is the second most common reason a patient will be referred to a neurologist. And there's other overlapping, very important features with FND. Many people with a history of head injury have FND. So concussion, almost 50% of people with concussion have FND symptoms. It costs America and the rest of the world a lot of money because these are often misdiagnosed, mislabeled, and mistreated. And there's a particular predilection in females, and there is a significant number of people with FND who also have a trauma history. And then if you kind of expand FND to look at other areas, well, it is prevalent in pretty much every single other field of medicine. And one area that I'm very interested in and working with are functional seizures. So people can actually have seizures that are not epileptic seizures. Let's see that here. So this is a video. So this gentleman here is having a seizure, right? And I'm going to throw it out there and say, I'm not going to tell you right yet if this is an epileptic seizure, which means seizures that are caused by electrical disturbances in the brain, abnormal electrical activity in the brain, versus a functional seizure, which would not. For instance, if I put an EEG on that person's head, it would be normal. So here is another seizure that this person has. And as you can see, quite difficult perhaps to determine which one is which. But in that video, the first one was actually an epileptic seizure, and the second one was a functional seizure. And so they can be very difficult to determine, very, very treatment resistant, and a challenging to diagnose, challenging to treat. So the question really is, if I'm talking to you about FND and I'm claiming it's part of neurology, and we extend it and we see in a lot of other conditions, where exactly do we find FND in the brain? Where can we localize this to? Brain networks. That's where we find it. So FND has a lot of good science that's kind of come to the forefront, a lot of imaging data that has shown that it is a disorder of brain networks. And it's way beyond the scope of this, but happy if anybody has any questions to dig into some of the science that's showing this. So looking at the applications in neurology, what really are the applications? Well, the applications in neurology going forward and other fields of medicine are those disorders that are that are localized to brain networks. So functional seizures, FND is one. Headache and migraine is coming. There's already been a trial in migraine out of Yale, and more to come. And also persistent symptoms after concussion have also been shown to be a brain network disorder as well. And again, functional seizures being the area that I'm focused on. As mentioned, there are already some good theoretical underpinnings showing that FND and functional seizures are actually a disruption of network connections. And this kind of image on the right is comparing FNDs and controls with people who have had history of abuse. So abuse seems to kind of cement and imprint abnormally connected networks, which become fixed and later produce FND symptoms in people. And again, this is highly treatment resistant, very, very little treatments for this. So knowing that psychedelics are brain network medicine, FND tends to be a disorder of brain networks, what can we do? Well, we can just put those two together, and some people have already started to look at this. So there's been a few reviews looking at psychedelics as a treatment for FND. Our group here was the first group to present a case report on a patient we treated with functional seizures who did very well. So ultimately, what we can say is that psychedelics have this transdiagnostic application, as we saw, but the real leap is we've got to update that to see that there are other applications of psychedelics that are coming down the pipeline. I do have a case that I can share, that case that I mentioned. I'm very happy to share the details, but in the spirit of time, I'm going to just jump right to the take-home points here. So these are the major take-home points for everybody out there. Right? As mentioned, psychedelics are brain network medicine. FND, particularly FND, but there are others, are brain network disorders, and thus there's this transdiagnostic application. The last piece here is a piece that's very important to me. So my perspective with psychedelics has always been that we have to contextualize this medicine within a field of expertise and not the other way around, meaning that a psychedelic practitioner is not going to be, for me, in my opinion, not going to be a profession going forward, but someone who has expertise in psychedelics within their respective field will understand the conditions and then realize how to use this tool of psychedelics within their field of expertise. And I think that's a real important perspective, and one in which I've come forward really looking at this whole idea of psychedelic neurology. So thanks everybody, and looking forward to listening to and hearing questions and taking some questions.
Thank you, Evans. There are questions, but I know Federico Menapace, Deputy Director at MAPS, has a tight schedule, so we'll give him the floor and then perhaps ask the question to you or Reid. Federico, the video is yours. Welcome once again.
Grazie, Marco. Yeah, it's good afternoon, everyone, and it's really good to see some familiar faces from the Numinous team. Really great introductions on the topic. My name is Fede Menapace, actually from Italy. Sono nato a Trento. For about the past 12 years, I've lived in the US. For the past 5 years or so, I've been involved in psychedelic medicine, and at MAPS, I now cover the role of Deputy Director. MAPS, or the Multidisciplinary Association for Psychedelic Studies, has been talked about by some of the presenters today, is a 37-year-old nonprofit organization based out of the US that has been working on supporting psychedelic science, particularly studies on MDMA-assisted therapy, to bring through the FDA process clinical trials to eventually, hopefully, obtain FDA approval to make MDMA into a prescribable legal medicine in the US first and then around the world. And so for about 2 decades at this point, we've been involved in conducting and sponsoring clinical trials, particularly for MDMA-assisted therapy for post-traumatic stress disorder. And yeah, as some of the members of Numinous mentioned, we've completed our phase 3 campaign with the FDA, and we're in the process right now of preparing all the documentations to submit so that we would hope, if everything goes well, approval would happen about mid next year. And now we're shifting focus from conducting research to getting ready for commercialization, which means making the medicine available to the therapists in the United States that are trained on how to use it within their field of expertise, and being able to deliver the medicine to patients. So that also comes with therapist education that we've been doing for a while in the US and also around the world. In the US, we also have right now a scheme called Expanded Access or Compassionate Use. This is actually something that exists in the US and abroad. It's somewhat similar to the Special Access Program that was being talked about, but not really. We've had approval from the FDA to treat, for clinics to treat up to 50 patients, and many have already been treated in several clinics around the country. So besides having sponsored research and conducted research on MDMA-assisted therapy, what else do we do in the world of research? So at MAPS, we've been funding other types of psychedelic research in the US and around the world. I'll just mention some that are recent grants that we provided. So we're supporting research on the use of MDMA-assisted therapy for couples therapy in several different scenarios, inside and outside of the VA or the veteran administrations as well. For example, cognitive behavioral conjoint therapy in an institute in Canada called Remedy Institute. And then we've been funding research in Europe for use of ayahuasca for grief, as well as research at Emory University on mass exposure therapy for the treatment of PTSD using MDMA. And then we also are looking at other applications of MDMA, and one that I think is particularly relevant in today's situation is that a few months ago, we partnered with the Conflict Resolution Lab at Hebrew University that is helping us develop measures and a treatment protocol to actually conduct a trial with Palestinians and Israelis taking MDMA together in a group setting, and see how that might help with essentially their how they interface with the issues of trauma and war and conflict. So we think that this is particularly important given what's happening right now. And actually, one of the Numinous speakers mentioned one of the studies by Leo Roseman at Imperial College, who already partnered with us in the past to do a study on Israelis and Palestinians drinking ayahuasca together and then interviewing them. So that research is actually available. I recommend people taking a look. And so besides clinical research, we also do public education. And so we help educate people on psychedelics, what they are, what are the potential beneficial uses, or how to reduce harm or potential risks of using psychedelics. Particularly, we host a conference that just happened last June in Denver. It's going to happen again in 2025. So I invite everybody. It's called Psychedelic Science. And we had over 12,000 people this year with over 400 speakers from all over the world talking about research, education, drug policy reform, indigenous uses. And actually, I'm very glad to announce that we've been recording all the sessions and we're slowly posting them on the website. So if you want to be able to watch everything that was talked about, you can now go to psychedelicscience.org. And there's a way to sign up for the website and then being able to watch all the sessions. And they'll soon be subtitled in different languages. We also have an online course that people can take on how to learn more about psychedelics or potentially get ready to experience a journey or being able to sit for somebody that's taking them. And so that's going to be on our website, maps.org. We also conduct professional education. So we provide education for therapists in the US and abroad so that they might learn about trauma, PTSD, and how MDMA can be used as a tool within the context of our protocols to actually help treat it. And we've trained therapists in the US and Canada, also in Europe. Recently, Australia created a regulatory framework that's kind of similar to the special access protocol in Canada. So we sent some trainers in Australia to educate therapists there. But we also do it in places that are not necessarily in the Western world. A couple months ago, we hosted a therapist education program in Sarajevo, where we actually had about 20 Ukrainian therapists that had a permit to leave the country just for a week to come and be educated, as well as both Bosnian and Serbian therapists. And so these are all cultures that have been at war. We had Armenians that actually were in conflict with Ukraine in the past. And so it was really, really interesting to see how our education on MDMA could bring therapists together that come from completely different backgrounds and from countries where PTSD is essentially ubiquitous. Like you could expect essentially everyone in the places where they live to struggle from PTSD, from conflict. And so we believe it's important to continue to educate people around the world, especially in the places that most need these types of treatments. And then so it was mentioned about drug policy reform and how some states in the US already, some cities and states have already decriminalized the use of natural medicines. And so we actually built a training program for first responders, particularly in the city of Denver. So we will be helping educate over 3,000 police officers and emergency medical services and also mental health services providers. Because if people are going to be in a psychedelic crisis from taking psychedelics and not being in a safe environment on how to, or knowing how to navigate, you essentially, you don't want a policeman to show up with a gun and arrest them. Like that's not going to be helpful in the context of what's happening. And so educating first responders is very important. And we're actually going to be scaling this program nationwide over the course of the next few years. We touched a little bit on drug policy reform. And so MAPS is also active in educating policymakers at a state and federal level on psychedelic drug policy reform. Particularly, many states have initiated ballot measures, or in Italian, we would say referendum. So asking people if it's okay for them to decriminalize certain psychedelic substances. And so we help assist those measures and advise on the languages and on the implementation protocols that the states undergo after a positive vote from the people. And so over the course of the past year and a half, we've been advising on over 20 legislative measures We've been passing regulation in different states, importantly, because once if the FDA were to approve MDMA assisted therapy and then later psilocybin therapy, the DEA, or the Drug Enforcement Administration, has 90 days to automatically deschedule these medicines from Schedule 1 down to lower schedules. And that then automatically, about 50% of the states in the US will deschedule, but not all of them. So we need to pass regulation in the other states so that automatic descheduling will happen after DEA deschedule. So we've been doing that in a number of states, including a couple of weeks ago, California. Although on the minus side, unfortunately, in California, Governor Newsom just recently vetoed a larger psychedelic natural medicine decriminalization bill, which is unfortunate, but also there's going to be more measures in California trying to pursue the same results. Lastly, I'll talk about international work. After FDA approval, hopeful FDA approval, we would then resume studies in Europe to pursue regulatory approval with the European Medicines Agency. And we support a number of international affiliates that are international and nonprofits that are separate from MAPS and independent, but license the MAPS name. So we have MAPS Canada, we have MAPS Israel, MAPS Germany, and we are soon to be forming actually MAPS Italia. So I would welcome everybody to check out the mapsitalia.org website. This is an initiative led by a few local researchers, scientists, activists, and drug policy reformists that are passionate about educating in the country of Italy people and legislators about the beneficial uses of psychedelics. They've already published a book that actually summarizes some of the psilocybin research that was talked about in Italian. It's very accessible, very easy to read. It's called Il Bosco Fiorito. And they're starting to host a variety of events around the country, likely a conference next year. So I really encourage those of you here in Italy that want to learn more to go to the website and sign up for the newsletter so that we can build more community around this. Okay, well, I feel like I covered a lot. Marco, if there's anything specific that you want me to touch on in the next couple of minutes, otherwise I know that there are questions for the rest of the crew as well.
No, I guess you covered the whole thing, and actually thank you very much for the commercial on the book. The book actually went sold out very soon, so they have reprinted some 200 copies, and 100 of them will be available in Milan during the Congress of the Luca Coscione Association. I know you have to other meetings to attend to, and thank you very much once again, Federico. And we look forward not only to register at the website to see, to watch and hear what was said in Denver. And some scenes were more like a rock concert because of the number of people present in the room than a conference on psychedelics. But congratulations also on that to you and the entire MAPS group in the US. Before we move to Tadeusz, and I think it's interesting to have someone coming from Poland where the other day a major change occurred and perhaps can also be good news in terms of drug policies. We have two questions. One was deleted, but I think, yes, we can retrieve it and perhaps it's a question for Evan and Reid. What are the counter effects of psilocybin and MDMA? And if they depend on the doses or the people and the condition of the people. That's, I think, a broad question, but if we can have some sort of a typical answer to this kind of typical question, because we get them a lot, that would be welcome. Head or tail, who's going to start? Someone will start. So that's I take it. Reid, you spoke first, so perhaps you can go first, and then.
Sure. Happy to. Is the question, what are some of the adverse effects potentially of psychedelics?
Yes.
Okay. Yeah, happy to take a crack at that one. It depends on the medicine being used. I think it's a different answer for classic psychedelics like psilocybin versus ketamine versus MDMA. But one thing they have in common, a couple common themes are the potential to exacerbate or unearth a psychotic kind of episode. So we screen people to make sure there's not any active or recent psychosis or a personal history of psychosis. Studies even typically exclude people with a first-degree relative who has psychosis. We're learning more and more about this, and in ketamine in particular, it doesn't seem to be as much of a concern as previously thought. We're understandably being very cautious until there's more and more big data to analyze, but it seems like it may just be more pronounced dissociation for a time, but regardless, we watch for that. We look at cardiac issues because all of these medication classes speed up heart rate, increase blood pressure in a transient way. So the way that one of my kind of MAPS mentors put it during when I was going through training there was like, if you can tolerate like brief exercise, like a vigorous walk, and what that does to your heart rate, you can tolerate this transient increase. But regardless, we have blood pressure parameters, make sure it's well controlled first. And then I also mentioned in my slides that there is the chance of a difficult experience, a really challenging one that can be lasting, and it's important to take all these into account because psychedelics are not without risk, and they're not for everyone, and do need to be. I really strongly believe there needs to be a good screening and evaluation process and good support throughout.
Thank you. Evan?
Yeah, I would certainly echo what Reed said there, right? And when we compare these drugs to other drugs, there's quite a high safety profile, or high safe tolerability and a good safety profile. I'll take this question in another direction and kind of pose some things that are important to recognize. So from my perspective, there's a lot of people with epilepsy. A lot of people with epilepsy have concurrent mental health conditions and are looking to treat the concurrent depression or something like that. So and there's this, you look to the trials, many people with epilepsy were excluded. Well, that's the presumption that these drugs cause seizures, which there's no foundation for that. So as much as we're worried about the effects that are out there that cause side effects, we also it shows that there are certain trends in the literature. There are certain preconceived notions that require us to explore these in a much more specific and a much more detailed manner. I'll give one other application. There's people with spinal cord injury. Okay? If you have a complete spinal cord injury, what this does is it upregulates peripherally your serotonin receptors. And with extensive anecdotal reports online, you can read about people who have spinal cord injury with very low doses of psychedelics, specifically the classic psychedelics like psilocybin, DMT, and LSD, have very profound side effects, very dangerous and profound side effects. So we wrote a paper about this. We put together all of the kind of Reddit posts about this from people with spinal cord injury, many people ending up in very severe muscle contractions, autonomic symptoms. I actually know of one case where someone ended up hospitalized for an entire week in the ICU, intubated because of this. So that's in spinal cord injury. So as we have to really open up and look at this, with a broader eye. There's certainly safe, but there's some conditions in which we have to. They're absolutely safe, and some that they are not. And so I think this is still a big question out there, and there's a big area of research that's needed for this.
Okay, there are other questions, but we can take them later on. One is easy, so I'll go ahead. The website that was mentioned before by Federico Menapace is psychedelicscience.org. So one word, or perhaps 2023.psychedelicscience.org, and you can register, and you will be advised or informed when the postings will start. Now we have Tadeusz Howard from Parea. Parea is, I think Tadeusz is better placed to explain what Parea is. Welcome, you have the floor.
Thank you, Marco. Thank you for having me here. And I want to start by saying that I remember still when I came across your work on Science for Democracy and how impressed I felt right away when I went through the website in terms of how much you've achieved already. So thanks again for having me here. I will show some slides where I will speak about PAREA. PAREA is for short, and the full name is Psychedelic Access and Research European Alliance. And as you can figure out by now, we'll be talking all things Europe and regulation. So there we go. So this is PAREA. This is really at the heart of this collaboration. We are a membership-based organization that brings together already existing groups. I think something froze.
Try to take it out. And
can you hear me? Can you hear me? Because
yes.
Okay, because everything went black here, so I will just maybe disconnect something. So anyway, we are a membership-based organization, and it's not only about directly bringing together the psychedelic ecosystem, because yes, we do have, as you can see here, psychedelic specific groups. Whoops, something just came up. Okay, I have to share my, I have to go full screen again. I'm sorry for that. My computer is just acting silly. Okay. Let's see the cursor, there it is. Okay. You have this the full screen back, I hope. Sorry again for that. So we bring together groups like Beckley Foundation and Drug Science and so on, but we are also bringing together other organizations. First of all, I suppose it's EU-wide patient advocacy groups, because we shouldn't forget that the reason why we are doing this, at least PAREA, because we focus on the future prescription use within medical context. So here, patients should be at the center, and this is why we are doing this. Patient or people with lived experience. So we have among our members GAMIAN, for instance, which stands for Global Alliance for Mental Illness Advocacy Networks, Pain Alliance Europe, or European Federation of Neurological Associations. And we heard from Ivan about potential for neurological conditions. And for me, it was important to recognize that, hopefully in the future we'll be going beyond mental health and include also neurology groups. And then we have also professional organizations such as European Psychiatric Association, or European College of Neuropsychopharmacology, European Brain Council, Association of European Cancer Leagues. I would say the idea really is to understand that without trust and broad engagement from those professionals, we will not get far in terms of future access. So all these groups need to be involved as early as possible, and this kind of thinking is built in this partnership from the get-go, from at this level of our membership structure. So with this, I want to also mention that given that we are in Europe, that psychedelics is a word that comes from Greece, we were also inspired by that. And PAREA is actually a Greek word which denotes this concept of people coming together, spending time together. It also means to party. But I would say, that it conveys this notion of togetherness, and this is something that also, is guiding principle for us. This is the team. The PAREA is chaired by Professor David Nutt, whom you probably all have heard about. We have vice chairs from Pain Alliance Europe and European Brain Council, and I'm the founder and executive director, supported also by now by Anna Farkas. Now, I want to speak a little bit about how the EU works, because I think it will be setting the stage for for understanding a little better what we are doing in Europe. And there was a reference earlier, I think, made by Marco, maybe by complexities that we have in Europe. And indeed, it is a kind of complex beast, the European Union. In terms of its architecture, we have three main EU institutions that are holding legislative and executive powers. And this is the European Commission that is representing the EU-wide interest. The Commission has a number of what's called directorates general, one for health, for research, for economy, and so on. And it also has these agencies that it's supervising. This includes European Medicines Agency and European Monitoring Center for Drugs and Drug Abuse. Then we have the European Parliament, which is elected in democratic elections. There will be elections to the Parliament happening next year in June. And so it's representing the EU citizens' voice. And finally, the Council of the European Union, which brings together all the member states' governments. So EU, I think it's worth to add that EU is really a major player also in global health by virtue of its economic size and power and setting up regulatory standards that are often adopted globally. And I'm mentioning this because, much to my regret, not many drug developers in psychedelic space at the moment prioritize Europe, really, which means that we don't really know when we hear about possible approvals in the US in the next year. Hopefully, Australia has already rolled out psychedelic assisted therapies, but it's hard to say at the moment when we will see first psychedelic treatments reaching patients in Europe. Another thing which maybe differentiates us, for instance, from the US is that healthcare is generally provided, or healthcare systems provide free access to care. The majority of drugs are paid for by public funds. Another feature is that we have this central regulatory approval mechanism. But kind of good news end here, because while we have this EU legislative superstructure, there is this huge divergence in terms of different countries, because the healthcare provision is a national competence. So that means that it's up to countries, all the 27 EU member states, which drugs they will adopt. So that's one way of seeing this in terms of RNI, starting with RNI, which is global. Then there is an authorization by EMA, but then market placement, pricing and reimbursement, distribution and supply, and costs. These are all happening at the national level. And I'm speaking about this because this creates huge access inequities, which will also affect the rollout of psychedelic treatments once hopefully they are approved in Europe. It's not like they will be available to all the patients. You can see here an example of this. This shows how many drugs were approved by EMA in the last 4 years. So this is around 168. And as you can see, it's very uneven how many drugs are then available at the national level. I'm showing here Italy. Italy is actually scoring really well, but we have countries like Cyprus, Croatia, Latvia that have multifold difference. They have very little new therapies available to patients, and the same problem is when we look at time to access, how many days it takes for a new centrally approved medicine to be available. So you have Germany 128 days, and then you have years in some cases. Italy here is a little further. So that's a big issue, and that's something we have to keep in mind when discussing accessibility in Europe. Also keeping in mind that we are observing this huge shift from whether a drug will be approved to whether it will be actually covered by payers. And this is the only thing that will provide true access. So these are the issues that we are grappling with in Europe, and this is why there is a number of initiatives that the EU has been recently rolling out to address these access inequities. The biggest one is a revision of the EU pharma package, again, hugely relevant to psychedelics, and as Parea, we are working to spotlight psychedelics as part of this work. The idea with the pharma revision really is to redress these imbalances by changing the incentives and incentivizing areas of unmet needs. Then we have a health technology assessment regulation. Again, this concerns whether treatments are either reimbursed or not. Countries decide looking at the value for money, because the resources are limited, so there have to be prioritization decisions. There is a work to streamline and accelerate the clinical trials development, and very importantly, the EU finally starts to prioritize mental health. They released this comprehensive approach to mental health, where 1.223 billion euros is earmarked for various initiatives. And one interesting project will be on multidisciplinary training for health professionals in mental health. So the EU hopes to train 2,000 healthcare professionals in mental health until 2026. And hopefully we could see similar project from the EU money going to psychedelics at some point to train future therapists and facilitators. Now back to Parea. So what we are about really is trying to create this conducive environment for psychedelics in Europe, and this we do most importantly through education, because that's where everything starts. And contrary to what we might be thinking, the vast majority of people and a lot of policymakers still have no clue about the scientific advancements. They still live in this era of decades of bad press. So the work starts here, and the more we build familiarity with policymakers and citizens, the more chances we have then of smooth implementation. We also engage with scientific communities. Part of this is done through the Parea membership, but not everyone is a member. I was, for instance, a few months ago sitting in the panel at the Congress of European Federation of Psychology Students Association, speaking about psychedelics. A few weeks ago, Parea facilitated a session on psychedelics during the European Pain Federation Congress. And to our knowledge, is the first time when psychedelics were discussed by the pain community. So all this work is very important before we even go to a policy work. Then we also kind of zoom out, go one level up, and not just support the psychedelics, but also more prioritization going to mental health, because as the saying goes, the lifting tide or raising tide will lift all the boats. And we've been building relationships with key policymakers across all the kind of EU landscape, both with European Commission, Parliament, member states, the agencies, and many other groups. Another important dimension of our work is calling for dedicated research so that we have more data supporting safe rollout. And I'm also happy to share informally that early next year, there will be a major announcement of a EU-funded project. It will be the first time when the EU will put significant amount of money. This will be to the tune of 6 to 7 million euro to a clinical trial in Europe. There is a consortium of around 20 members, and there will be 4 clinical sites in the EU countries where there will be a clinical trial on psilocybin-assisted therapy for palliative care in non-cancer populations. So there will be 4 conditions, and 3 of them will be neurological. And this will be, of course, looking at kind of end-of-life anxiety, depression, and so the comorbidities with mental health conditions in those populations. We also have a strategic partnership with media, especially with Politico, and it's worth mentioning here that Politico is the most influential media in Brussels, and 80% of EU policymakers admit that they take political work into account when they make decisions. And this is an example of this intersection of Politico and EMA in our work. This is a quote from Stefan Tierstrup, who is Chief Medical Officer in the European Medicines Agency. he was speaking with Politico a few months ago, where he said, "I'm excited by what we've seen so far in scientific literature. This looks promising. EMA is meeting regularly with PAREA to keep up to speed on these therapies developments and to help to prepare developers for the regulatory task ahead." And I have a couple of more slides, and then I'm done. I hope I'm not exceeding my time already. I want to give you a sense of some concrete activities that we are doing. PAREA, together with another group called Psychedelics Europe, has this year set up a members of the European Parliament action group for the medical use of psychedelics. So this is a permanent structure in the European Parliament where we organize meetings and get engaged with different regulatory processes with the support of a number of MEPs who are members of this group. PAREA issued several policy recommendations in the last few months. Really, in the last couple of months, we released a pharma legislation position paper, policy brief for the EMA, because EMA is going to organize a multi-stakeholder workshop. This will be one-day workshop to promote the development of psychedelic therapies. This was announced in March, and this was a direct result of PAREA lobbying, because we were asking EMA for this workshop. And so we created this policy brief to guide preparations and to guide the kind of the thinking of EMA. In it, we called for a creation of a multidisciplinary advisory group that could, come together, be led by EMA maybe, and start developing EU standards when it comes to delivering of these therapies. We also released recently a EU election manifesto, and then I'm working currently on a position paper on unmet health or medical needs, which is a hot topic in Brussels. And finally, I want to finish with what matters to us as a collaboration. First and foremost is ensuring an optimal care and safety for patients and participants. We really want to create discussions at the EU level early on to avoid a situation when psychedelics are introduced prematurely into European healthcare systems in ways that can endanger people's health and also endanger a long-term sustainability of those medicines. We had enough troubles last century with this. So to this end, we want to encourage the European ecosystem to develop expertise and infrastructure for the highest quality, safe, affordable, and equitable access to those treatments. And let's not forget that there is a difference between innovation and deploying innovation, meaning that the results from trials become available in a routine healthcare in equitable and timely manner. So it's an important bridge to gap here. We encourage standardization. We want to drive meaningful regulation, set up some sort of an EU level implementation platform so that we don't have countries working country by country on coming up with standards of care, but having EU providing a platform for all the countries to come together. We forge partnerships, connect various dots. We call for an investment in under-researched areas, going beyond only research on kind of tweaking the molecules. And we think that in the future, we should gradually expand access, move prudently and slowly and see what works, what not, rather than, try to maybe throw psychedelics therapies at millions of people at once, because these are powerful tools, and we believe that this iterative approach will work best and in a way prioritize safety while still recognizing that we need these treatments to be accessible urgently for patients who need them today. So that's it from me. This is a picture from the European Parliament. We are having another meeting in the European Parliament on 6th of November. This will be on pharma strategy, and when I finish my talk, I will share in the chat the link. You can register also for a virtual participation. Thank you.
Thank you, Tadeusz. I'd like to thank some people that in the Q&A window has informed us the passing of Roland Griffith, one of the leading scientists and and pioneer in the field. I think we can have a moment within ourselves. We don't have much time, but I think there will be time and opportunity to go back on the legacy that Griffith left us, Johns Hopkins University, where he was working. I think this has been a sad year for a variety of reasons, internally and also externally, and it's even a sadder year for what is happening in some of the regions that have been announced before as places where studies on PTSD for people in conflict are taking place. But I think, I don't know if there's any kind of sign that we can do to remember Roland Griffith, but he is in our hearts. So, there's only one answer that I'd give, but there are questions coming. So we'll share them later. The website that Federico Menapace said before is mapsitalia.org, where you can find information about what's happening on the launching of Maps Italia. And you can also, I think there's a newsletter that you can sign on to and then receive updates. We remain in Europe. I also have a question for Tadeusz, but I'll put it later. With Theo Jubilei, who's is the founder of the Psychedelic Care European Citizens Initiative. This is one of the other complicated things that happen in the European Union when they happen, and Theo will explain what this is and what is asking. You have the floor.
Thank you. If you can see my screen, it's all right. Perfect. So just to begin with, I would like to thank you again for the invitation. I'm really glad to present today the Psychedelic Care Initiative. So my name is Theo. I have a master in European politics and public affairs from the School of Political Sciences in Strasbourg in France. And then I moved up to Brussels to work in the European affairs. And I launched this project, the Psychedelic Care Initiative, a bit more than a year ago now. So I will present, for the ones who don't know what is a European Citizen Initiative is, then why do we need a European Citizen Initiative on psychedelics and mental health, and then what is the Psychedelic Care Initiative, the request, the objectives, and where we are going to. So first of all, if I can, what is a European Citizen Initiative? In a few words, it is way more than a petition. It is a democratic tool introduced in the Treaty of Lisbon, so enshrined in the EU treaties for citizens to help shape the EU laws, to participate in the EU legislative process. So it is a one-year transnational campaign, where you have to gather 1 million signatories to officially ask the European Commission to take action on something. So you have to be at least 7 citizens coming from 7 different EU member states and to draft a proposal that has to fall within the framework of powers of the European Commission. So basically something the EU can do based according to the treaties. Then when you have done that, you register your initiative by the European Commission. And starting that point, you have exactly 1 year to gather those 1 million signatories coming from at least 7 different EU member states and has to be EU citizens. Once you get those 1 million signatures verified, certified by the member states, the European Commission comes back to you and has the legal obligation to say how it might and how it will take action on the proposal the citizens brought to the Commission. So basically, it's a way for citizens to impulse the change of laws in the EU. So it comes before any initiative by the Commission, but just to bring citizens together and bring legitimacy to the Commission to say we want, as EU citizen, you to work to take action on this subject. That's for the European Citizen Initiative. It's getting more and more used by citizens across the EU. You might have heard of already successful initiatives. Recently, there have been more than 4 initiatives that gathered 1 million signatures in the past 2 or 3 years. And so that's why we believe it is an amazing tool to make things change in the EU. But why do we need one on psychedelics and mental health? And I won't spend too much time on this side. We already talked about this, but there is a mental health crisis in the EU, which affects more than 1 in 6 people. And that puts pressure on individuals, families, communities, causes immense suffering, and puts pressure on the health, educational, economic, labor and social welfare system across all EU member states. And no science shows, as we heard in the previous presentation, that psychedelic-assisted therapies can actually help people in need that are today suffering. And we believe that each EU citizen shouldn't have only access to those therapies in 1 or 2 member states. So maybe not only in the Netherlands, or not only in Czech Republic, or not only in Italy, but in every EU member state. Every EU citizen should have the right to access psychedelic therapies if needed. So there's also European momentum to act because mental health has moved up the European agenda, notably since the COVID-19 crisis. And as we just heard with Tadeusz from Parea, there has been interest associations working at the EU level on psychedelics compounds. The European Medicine Agency has interest on that matter. There is the members of European Parliament Political Action Group created in the European Parliament. Psychedelic-assisted therapies have been officially recognized by an EU institution for the first time. So there is this thing happening on psychedelics at the EU level. And as Tadeusz said, it's hard to say when we will see psychedelics-assisted therapies introduced in the EU. What we want to do is that it shouldn't just happen in Brussels, but the citizen should give the impulse to the Commission to take action on it, to accelerate the process, in hand with the scientific community and in hand with those interest associations that have the expertise at the EU level. So that was the opinion from the European Economic Consensus Committee, recognizing the benefits and potential of the psychedelic-assisted therapies treatments. And so that's really why we want to launch this initiative. That's because we believe, as I said, that every EU citizen should have the right to access these therapies. But we also believe that we need a healthy and democratic debate around the psychedelic compounds, as we are doing today with those conferences, with those webinars, bringing together different people's engaged citizens, like-minded associations. We need a healthy debate on those compounds. And there is still currently a great deal of misunderstanding of what psychedelic compounds are from the part of the public and from the part of the decision makers. And so that's why also the European Citizen Initiative is such an amazing tool, is that because you create a momentum around one subject for 1 year, bringing together people and associations across the EU to work on the subject, so to help inform people. But I will dive in just in a few seconds on that. Really, it's time to believe that EU citizens raise their voice on that question, and that we give legitimacy and we impulse and we quite push the European Commission and the European institutions to take this subject seriously. So what is the Psychedelic European Citizen Initiative? What are our requests and objectives? As I said, I had the idea of the project more than a year ago now, but we started working quite quickly with the interest associations such as Parea, such as French Psychedelic Society in Czech Republic as well, in Belgium, in Italy, in Malta, in Luxembourg, bringing associations working on psychedelics, but also human rights activists, just people that are interested in the subject, to draft some requests and to define our objectives and our roadmap for this initiative. So we ended up with 3 requests for the European Commission. So the official requests, if we get the 1 million signatories, which are the first one is to propose an initiative aimed at establishing guidelines for the rollout of psychedelics, for the medical use of psychedelics in the EU, for all member states, for all 27 member states. Secondly, we want the European Commission to boost EU-funded research on therapeutic application of psychedelics compounds, but of psychedelics in general. And the third one is to coordinate the work of member states for rescheduling at the UN level for the 1971 Convention on Psychotropic Substances. So we've checked those requests with the European Commission Legal Service working on the European Citizen Initiative Forum, and they are legally sound. Just the third one, they said it's not really in the Commission competence. The first 2 are definitely within the Commission competencies, but the third one, we believe still after discussion that the Commission could set up a tool such as expert group to coordinate the work of member states and national experts. That's really our 3 official requests that we'll bring to the European Commission if we get those 1 million signatories. But the initiative, as I said, serves different purposes. And while creating a momentum for 1 year and bringing together all those actors across the EU and with different backgrounds, with different story, coming together, we really want to inform people, the general public and decision makers about the benefits of psychedelics for mental health and about what psychedelics are. And then to trigger debates in the mid and long term within the member states and at the EU level on psychedelics, mental health and drug policy reform. And of course, our overall objective will be to improve mental health in the European Union, either by achieving this initiative, either by getting those 1 million signatories and they get the EU to act, but also to bring together those actors and then create a long-term movement and people working together, getting interested in their own member states and getting involved in their local or national associations to put pressure on their member states. That's what we are aiming for with this initiative. And where we are is now that we drafted those requests, we got our first website, and we got the logo, the design, the title we've been working on since the past few months. And we are still in the preparatory phase of the initiative. So I'm really glad also today to present that because the launch is planned in 2024, either before the European election or after in September or October 2024. But we are really in the phase of structuring the initiative, meaning that we will create national teams in the EU member states. So for example, a national team in Italy, France, Belgium, to work on the strategy of the 1 year campaign. So to work on the targets, the events on the ground, getting partnership with universities, cinemas, festival, to gather those signatories. And then we're structuring the initiative around one European team as well, to coordinate the work of those national teams. So to coordinate on the legal status, the fundraising, the social media, all the work that will have been done to get a successful initiative done. So we are here now. So we will launch the first website and we are looking and now gathering with like-minded associations, really engaged citizens coming from different backgrounds. And we are receiving many messages from across Europe of people wishing to get involved, to help the initiative to get ready and to support it. And so if yourself or your association is interested in participating or learn more about this initiative, you can visit our website at psichedeliche.eu or write us at the email you can see or scan the QR code. And yeah, so we got a meeting on the 24th of October to present more in detail the initiative, how you can help, but otherwise we'll have also more upcoming meetings in the future. But we really believe that with this initiative, we can help make a change by bringing everybody together, and because we don't want only one member state or two to act on this question, but really the EU should move forward as one. So thank you.
Thank you, Theo, for this presentation, and the best of luck for the next meeting in a couple of weeks and next year when the initiative will start. We have a very attentive audience, and we have some 17 questions. I think many of them will be posed to Reid and Evan if they're still around and you have some time. We have another 20 minutes, so let's try and see what can we answer to these questions. The first one comes from Agnese M. I'll read them in the order in which we received them. Considering that practically all body organs are biodirectionally connected with the brain and that biometric fields may influence organ homeostasis, could psychedelics with their effects on brain networks influence, for example, normalize organ homeostasis in the long term? Would that be a question that has an answer in this?
Yeah, I can take that. So I think that's a really good question, and it's maybe the individual knows or doesn't know, getting ahead of themselves, but I would implore the audience to look at predictive processing. That is kind of a prevailing neurocognitive theory that has evolved in the last decade. Carl Friston is kind of one of the premier scientists that has really pushed this forward. Essentially, it describes the idea that the brain is a predictive machine. You can say there's some popular writers and scientists like Anil Seth and Andy Clark and Lisa Feldman Barrett as well, who talk about this. You can go on YouTube down a rabbit hole with all this. But essentially, it's about the process of allostasis, not necessarily homeostasis. Allostasis is the brain's ability to to make predictions of the direction in which the organ or physiological states are headed. And this is how our brain manages our internal kind of our internal system. So in that sense, that's all kind of, again, nested within brain networks and imprinted within brain networks. And there's certainly, the brain is the master control that is predicting at every single moment in time that direction that the organs are headed. And I think that's the overlap of where this question is going. And it's intimately involved in the whole theory around psychedelics treating functional neurological disorders. So yes, there's certainly a connection, and yes, certainly psychedelics can modulate this. So it's something to explore and something that would take, you know, a whole couple hours to talk about in and of itself. But predictive processing, I would implore you to look into that. And some of the people I mentioned, I can write them in the chat. So that's available to everybody if I can do that.
Or we can actually, because also other people are asking for a more comprehensive bibliography, perhaps we can have an email exchange and then put everything on our website, so to make things easier. Reid, you want to add something, or we can move to the next question?
No, let's go ahead and move on. Thanks, Evan.
Okay, so what are, and if there are, risks and benefits of these molecules during developmental age? So I would say from a younger age, because one of the reasons why I think this question is asked by an anonymous person is that because in Italy, when we talk about drugs, meaning narcotic drugs or any kind of drugs, so we don't have we use the word in a derogatory term. There is always the slide of a brain that has been burned by the use or abuse of any kind of substances. So I think, and it's usually of a teenager. So what are the risks and benefits, if any?
You know, I can start on that one. Just some brief comments. I remember in my med school training, there was this adage passed on to us that, you know, kids are not just small adults, and there are unique considerations, and we just don't have that much data on the developing brain and psychedelics. I will say that I encourage, the field to push the envelope on this in a good way in terms of doing the studies needed for kids and adolescents. I'm thinking of anorexia. I work a lot with eating disorders. Anorexia has no FDA-approved treatment options. It often comes on in adolescence, especially in women, and is the most deadly mental health condition that we know of. And that is one condition where I will think about ketamine, for example, earlier, or if psilocybin, MDMA were available, I would certainly view the potential benefits there of, outweighing the risks and give it a serious consideration because the stakes are so high. But there is, there is impulsivity to consider in teens. There is the developing brain. There is some of the things we think about stunting growth don't apply as much with psychedelics when you're giving these intermittent doses. But the way I approach it in the absence of good data is just looking, especially in teens, if all else has failed, and if there are serious safety issues like suicidality, suicide attempts, self-harm, that's when I will think about these interventions that are kind of newer, exploratory, but where there's really strong evidence in adults and some adolescent data, that I'll think about ketamine as an intervention. So those are just some initial comments.
Thank you.
So maybe I will just yes. I think the premises, as always with medicine, really is that no effective medicines is without risk, and then you're weighting obviously benefits and risks. So that's one obvious thing. I think when we look at other conditions in disease areas, for instance, there is ADHD, and there are millions of kids that are medicated sometimes, maybe over-medicated. So it all comes down to really, for me, on one hand, getting the right balance, because if a kid is severely disabled, maybe or his functioning is really impaired because of some trauma that happened or anything else, then surely it should be considered. But in the end, I think we are talking here about hopefully moving towards a wider societal acceptance of psychedelic therapies as valid and effective treatment modalities. If we see them as real medicines, then we'll think about when they are applicable and when not, including kids, in a different way. But maybe we are still not seeing them as real medicines, which is why we see this as some sort of a controversial topic.
Thank you. Evan?
Yeah, I wouldn't say I have much data. I get asked this question quite a lot as a specialist in pediatric neurology. And again, I'll come back to kind of the foundational mechanisms with this being brain networks. The brain in and of itself, and what it's doing from birth until about 25 years old, is networking itself. And so the networks are quite flexible. However, when you move into some conditions, like treatment-resistant depression and some of the significant mental health disorders that arise, eating disorders, as Reid mentioned, that arise in teens, that's really an aberration of the brain network. So, and it speaks to some of the treatments not working. So it might be that psychedelics are ultimately a tool in adolescence. And I just think we need a lot more research and understanding to do that in order to move forward. In the end, it's a risk-benefit, as mentioned. And I think the last piece here is to really be certain as we move forward to not conflate the research that has been done in the recreational data with that's being pushed forward in the medical field. It's a completely different ballgame. I do a lot of work with medical cannabis, with pediatric epilepsy, and the research that was pushed forward from recreational cannabis certainly does not apply in the medical context whatsoever. So we need to make sure we're looking at the data through the proper lens before we are making decisions and marginalizing or excluding kids that could otherwise benefit.
And just to add on adolescents, I don't know about the US or other parts of the world, but in Europe, suicide is the second leading cause among adolescents after, I think, traffic accidents. And it's not saying that we should give them all psychedelics, but, risks are very serious.
Thank you. Next question is again from an anonymous person. How is going the research for treatment of autistic symptoms? Could these substances be used also for children with autism spectrum disorder?
Yeah, I'm happy to start with that one for sure. Another question I get asked often, very interesting, going back to the predictive processing model. So prevailing ideas around autism are nested in this new model of predictive processing, where again, coming back to brain networks, the precision that allows brain networks to carry out their tasks seems to be abnormal in people with autism, and seems to be that it's too high. There's too much attention on certain aspects of perception. So autism is being played out as a disorder of perception and a disorder of altered precision amongst brain networks. So there's some very basic research, basic science-wise, with mouse models that are showing pro-social behaviors or the rescue of pro-social behaviors in autistic mouse models. And there's very small case series and work that's been done in humans with autism that have shown, again, some improvements in anxiety and pro-social outcomes and with exposures to psychedelics, I think particularly MDMA. There's a few, you go on clinicaltrials.org, you can find some current studies that are recruiting right now looking at for adults. So the answer to the question, as far as I know, up to date, is unknown yet, but there seems to be a theoretical basis for it, and there seems to be some preclinical work that supports it, and there seems to be some very, very, very early human data that might support it as well. So big question mark, and another area within neurology to be excited about, I think.
Thank you. Anybody else?
Maybe so I'm not a scientist, but I'll just mention the work of Gül Dolan, who is looking at critical periods and social reward activities, because she actually started doing research on autism, and drugs worked on mice, but they didn't work on humans. And on one hand, mice is not human, but then she realized that mice were getting the treatment that she developed very early in their development phase, whereas humans when adults. So there is also some very promising early data that can suggest that psychedelics are reopening critical periods of social reward learning. It's these periods that, for instance, animals will have in the first 20 hours where they make critical attachments to someone, mother or anything else, for instance, with geese. And so her hypothesis is that maybe in the future, there could be a combination of giving psychedelics, which would reopen this critical period, and then there would be an administration of a drug targeting specifically, and molecules targeting specifically autism, and these two could work in some sort of a synergy. But this is again also early work.
Thank you. Shall we move on to the next question coming from Manuela Loy? She hasn't heard anybody speaking about bipolarism, and in specific maniacal, the symptoms not associated with depression. Are there studies on the matter of bipolar disorder? Would like to read.
I could take that one, at least initially. That's one that's been studied somewhat with ketamine, but for bipolar depression, not for mania. And there's the same caution I mentioned around psychosis applied to manic episodes. There's the idea that the state of entropy that bring about by giving a psychedelic, whether it's classic psychedelic or ketamine, the same state that can be quite therapeutic can also in a certain contexts result in this perfect storm of unearthing, worsening a manic episode with similar mechanisms to the psychotic reaction. So it's something we just approach with caution and screening, and there are no studies, to my knowledge, of using psychedelics for that episode or during that episode. But there are some positive studies. There's even, to tie it into a recent question, there's a study of ketamine and teens where it improved this certain type of fear of harm phenotype in bipolar kids, and but this is again in the depressed state, and we're cautious not to shake up or worsen a manic episode. I do have some kind of personal experience with cases where after a treatment with ketamine or ketamine course, there was a first manic episode that we had to really work to reel in. So, it's a real phenomenon, but we don't know the actual numbers on the risk. That's to be determined.
Thank you. We have a lot of questions and not enough time, perhaps, so we'll get to the next one, which, can somebody point to current evidence on psychedelic-induced psychosis, like data epidemiology and the like? Is there any work that comes to mind, or any website that people can browse, or just go on PubMed and put a keyword?
I'll put an article, a review article from within the last year that I like on the topic in the chat, because I know we've discussed it a little bit, but just to save time. But I'll put it as a typed answer.
Oh, I have actually deleted the question, so perhaps we can actually put the link in the general chat, so Jessica can help us with that. There is another question. Well, no, I also deleted another question, so perhaps people that don't see their questions anymore, please ask them again. Simone Pompei asks, are there scientific studies that are studying the correlation between quantum physics and the mechanics of psychedelic molecules? I know that there are studies about consciousness and quantum mechanism like OR, but what about psychedelics? How's the progress? Could you recommend us some research to study? Will MAPS Association study this topic in the future? The question on maps should have been posed before. Federico is not around. I don't know if any of those of you that have also mentioned maps, I think, Reid, you have in your presentation, has an answer to that. And I'll ask Mr. Al-Osmani to put again the question that I deleted by accident in the chat. Wants to get a shot at that. So, correlation between quantum physics and mechanics of psychedelic molecules, anybody?
For me, the more I read about quantum physics, the less I understand of it, so I'm not able to answer.
Okay. Is there consensus on this answer, or there are other ideas about it?
I think we need a consciousness researcher here to answer that. I can't say that I could answer something like that right now.
Okay, thank you. We move to Roberto Ponziani, who's asking regarding the process activated through psychedelic substances. How do psychotherapy and psychiatry meet and act specifically? Are there intervention methods that favor the ongoing process, or do we stick to letting the patient live the experience exclusively?
So I could just add some comments on that. The one common theme or thread in the psychedelic assisted therapies is this concept that MAPS calls in their therapy training manual the inner healing intelligence, and a non-directive approach to trusting the wisdom of what comes up in the individual and going with that, and not trying to control too much or dictate too much the experience. Like the intentions even become like a loosely held hope that is somewhat of an anchor or vector for the experience. But the interaction between psychedelics and psychotherapy is really interesting in that psychedelics seem to create this brain state that is more ready to receive interventions, more neuroplastic, as we've been talking about, or malleable, or more of a learning period can open. And then there is this non-ordinary state of consciousness, like a mystical experience, new perspective from which to see oneself, one's patterns, to see the forest from the trees, if you will, have the cognitive flexibility to see both of these perspectives. And so the pairing of it can look like any modality well suited for the condition at hand, combined with the psychedelic seems to be an appropriate approach at this stage where we're still learning about like what is the best therapy for a given indication and a given medicine. A lot of work to do in this area, but it's a really exciting one in the synergy of these things and the mechanisms of change that apply to psychotherapy. With the psychedelic, it's thought to be accelerated and some of the obstacles removed, like MDMA. The fear reduction via the amygdala is a good example of taking down a barrier so the client can actually do their own work. Their inner healing intelligence can help them heal. And we're there to provide support, hold space, help them remove obstacles.
Yeah, I'll just follow Reid up there to come back to the case that I mentioned when I was talking with functional seizures. So someone who has a functional seizure, in some cases, it often can be an adaptive response that at one time served the individual, that helps them dissociate out of when they're faced with any significant trauma or any significant increase of their baseline level of stress. Then ultimately in time, these things become maladaptive because they're just constantly intruding. So people, the patient we saw was having 2 to 3 seizures per day, every single day, lasting an hour plus long. Her life was in shambles. So the idea here is that every time she engaged in therapy, she immediately had a seizure whenever she started to talk about her trauma. So what psychedelics did, as Reid pointed out in this particular case, it really allowed and permitted her to be able to start to speak about her traumatic experiences without her brain kind of, or her just dissociating into this seizure-like episode. And that ultimately was the important piece that has led to her longstanding change. Now it's been a year this month. So that's the interplay there that's really important to give something of a more of a specific case and speak to what Reid meant as kind of bringing the fear response down.
Thank you. I've been able to retrieve the question. Sorry, Tadeusz, because we really have another 6 questions and not enough time. From Osama El Osfori, who asks, is it possible to use psychedelic for disorders with psychotics? Are there any evidence of effectiveness of psychedelic on non-diagnosed subjects? Is microdosing a valid option? If yes, for which ones? Who wants to take that?
I haven't worked with patients with psychotic disorders. It's kind of out of my area of expertise.
Reid, anything?
So I'm trying to find the question. It was, could you repeat it for me? I missed it. Yeah.
Is it possible to use psychedelic for disorders with psychosis? Is there any evidence of effectiveness of psychedelic on non-diagnosed subjects? Is microdosing a valid option? And if so, for which ones?
Yeah, so microdosing wouldn't carry the same risks of triggering, in theory, triggering a psychotic event, but it also doesn't have the same mechanism or the same potential therapeutic benefits as a high dose psychedelic experience. It's really a different category, and you're more focused on some of the subtleties of an experience or some of the neurogenesis theoretical benefits. But people are doing this, as I mentioned, with ketamine cautiously. And there aren't modern studies looking at classic psychedelics at significant doses for psychotic disorders, but there were initially, like the paper that is now in the Q&A has a nice review of some of the early studies when psychedelics first came out. And Albert Hoffman, Sandoz, they mailed LSD to psychiatrists and psychotherapists all over, saying you could use this as a therapy aid or you could use it as an experimental model of psychosis. And so it has been studied, and there's some interesting stuff that came out of those old studies in the 50s, 60s on psychosis. But I'll just say we don't know enough to have protocols, algorithms, or much data on using these at high doses for psychosis.
Thank you. Sharon, I've seen you turned on your camera. You wanted to jump in parts of this discussion about also microdosing. Feel free. Otherwise, we move on to the next question by Roberto Ponciani. Regarding the processes activated through psychedelic substances, how do psychotherapy and psychiatry meet and act specifically? Are there intervention methods that favor the no, sorry, this is the one that we just did. Oops. Simone Pompei, what can you say about the phenomena where there is an apparent energy wave synchronization with insects and animals when experiencing psychedelics? Many people reported this thing. Are there also scientific studies or theories? Thanks, and sorry for the off topic. If it's an off topic, maybe it is, but sorry. Do you know anything about these studies about possible zzz in our heads when assuming psychedelics? Okay, I see heads shaking no. So we move to the next one from an anonymous. What do guests think about DMT, entities and DMT world? Do you think that our brain and consciousness is able to connect to alternative dimensions and perception? Is this affiliated with extrasensory perception? Is the material world only a veil of Maya hiding infinite patterns of energy, vibration, and pure consciousness? How can we map the DMT realm? What do you think of the getaway experiments led by the CIA in the past years? I don't know how many of you have been in touch with the CIA lately, but I know if this is a field of expertise, but if it is, or you have opinions about that, feel free to share them right now.
I can just add that there have been some interesting studies done of inhaled DMT and entity encounters, where the majority of individuals at a certain dose with these medicines, including actually with ayahuasca when taken orally in combination with an MAOI, the majority of people do have some kind of entity encounter. It's a unique signature of that medicine, and it tends to be more often than not benevolent or having some kind of positive guidance for the individual. The question of what are these things is way above my pay grade and level of expertise, and I won't even pretend to venture a guess, but I will say that each of these medicines brings about a non-ordinary state of consciousness that has some unique characteristics, whether it's the visual geographic patterns and that we're still trying to understand, or whether it's the body signature, or including these kind of entity type encounters. And I love to theorize on what those are and get into some of the collective unconscious and also the psychic phenomenon have been studied a little bit back in the 60s. There's some fascinating studies with psychedelics, and if someone can engage in these ESP type phenomenon, and the jury's still out. I'll just leave it there, but I appreciate the very interesting question.
Anybody else?
There is maybe also a thing to say about a collective unconscious and the myths and this type of things that are across the kind of humanity, and they can. One interpretation could be that they are manifested through some sort of encounters through the what we have encoded subconsciously, but there can be of course other interpretations too.
Thank you. Steffi has a question that in part I think can be answered possibly here. In part, I would suggest to send an email to mapsitalia.org to find more events in Italian. But the part that you can find an answer here is research on the therapeutic use of psychedelics on people with autistic people and with ADHD. Anything that can be suggested, or perhaps it's something that is a little too complex to explain in a few minutes, and perhaps we keep it for another day.
Yeah, as mentioned, Marco, I can send some links that might be helpful.
Great, thank you. Jonathan Massaro is a person autistic with PTSD. Would like to thank us for our work and hoping that to soon to be able to have access to these kind of substances. Another anonymous person that says RIP, Professor Griffith. May all the studies and initiatives that continue his legacy. We will never forget the progress and drove the scientific community towards psychedelic therapy. I think this is actually the last two messages rather than questions, I think, from Gabriele and Nicolardi, and there are perspectives for the use of psychedelic substances to optimize processes, learning processes outside the pathological field. If that makes any sense.
Yeah, I'm happy to answer that. I think yes. I think this is going to be a very interesting deviation we're going to see with psychedelics into perhaps wellness. I mean, this is already being explored with microdosing in the context of wellness and creativity and just betterment of mood and well-being. So we're kind of seeing that already, but I do think, again, coming back and understanding the underlying neurology, not to continue and keep on bringing up the idea of predictive processing, but it really is important to understand this. Predictive processing not only offers us our ability to perceive the external world through vision and our senses, it also is a theory of movement as well. And so our movement is tied into this theory, and our movement is very much ingrained and imprinted in the way that our brain networks are established. So therefore, I do potentially in the future see psychedelics used in athletic training and also for rehabilitation. So I would, I know there's big eyes here. I'm talking about the future. I'm not purporting this is it. I'm saying this is an application when you really understand the networks. Small doses of psychedelics, not big doses, small doses of psychedelics do loosen movements. There's a lot of anecdotal discussion about this in terms of yoga and other certain areas. You hear this in the psychedelic community. So I do think in time, when safety is kind of laid out, you're going to see this in terms of training and athleticism. Understanding predictive processing will allow one to understand why I'm making that connection.
Thank you, Evan. I have another question, two questions actually myself. The others have been exhausted. If Sharon is still with us, one would be for her. Otherwise, this is for Tadeusz. The study that you mentioned that is going to be funded by the European Union will get the money from the Horizon Europe. Okay. So can you repeat the amount? It's like 3 million?
No, it will be between 6 and 7 million euro for a 4-year project clinical trial that I mentioned.
And do you remember under which chapter? I'm asking this question because when they were in the final stages of consolidating what could have been funded through Horizon Europe, which is the framework program through which research will be funded in the European Union to 2027, I believe, or 26. There was not much knowledge about this kind of development. So I'm very glad to hear that maybe thanks to your work, such knowledge has been spread in the right places. But I was curious to know under which chapter, if you remember.
So it will be tackling diseases chapter. If that tells you something, and again, it's very important because it's the first time we'll have this EU-funded major project, but also this will provide further legitimacy to the field because Horizon Europe is a very prestigious European collaboration. So this will be sending certain messages too.
Thank you. And last question would be on the regulation topic. We heard that when and possibly very soon, the FDA in the United States will agree for the medical use of MDMA for PTSD, that each state will have to re-regulate or add their own views about the regulation. That would be the same in Canada, or once a decision is taken at a central level, that's valid for all the states of the federation?
So in Canada, it works a little differently. You have the federal regulations which would implement MDMA for PTSD as a drug product, and then the province and the municipalities would govern the implementation of using it. So basically, how it would look from a payer perspective on health insurance, how it would look on delivery. Would certain, if you were holding MDMA in clinics, the storage, the security, because it's still considered a narcotic. So they wouldn't implement any regulations as to the drug product itself. From the federal government's already approved it, so there's no additional approvals that have to be done at the provincial or the municipality level. But how it's implemented, what safeguards need to be put into place, that would be implemented at the provincial and municipal level.
Okay, is this similar to what the EMA would do, Tadeusz, or would there be an option to sort of opt out of the decision? I'm asking this because the Italian Ministry of Health in the middle of August adopted a decree to include CBD in the schedule of controlled substances, despite the fact that the European Court of Justice a couple of years ago ruled that if something is recognized as producible and sellable in the EU member states, no other EU member state can prohibit such a thing. So the question is this: so how would it work in the EU, Tadeusz, and if the opting out, so to speak, system would also be available or allowable in Canada? Sure.
Yeah. So obviously I can't speak to EU regulations, and I can't speak to what goes on in individual European countries. We do have the same caveats in the US, where each state can supersede regulations, federal regulations. So MDMA being approved as a drug product for therapeutic use for a specific condition of use is separate from what the states are currently working on as far as psilocybin and psilocybe species mushrooms is concerned. So that is very similar to what's happened at the state level for cannabis in the US. In Canada, it's always going to be federally mandated. Even the cannabis regulations came down from the federal governance and were implemented at a provincial level. What we're looking at here is narcotics being used as a drug product under a therapeutics directorate, which is not the first time that's happened for a narcotic product. So this isn't novel. The way that it's done in Canada is a little bit more streamlined than it is done in the US.
Thank you. Tadeusz, what about you?
So there are a couple of things. One is that psychedelic therapies differ a bit from what we see with cannabis, because they are kind of engineered as pharma-grade substances going through rigorous trials. And it's not always the case with cannabis. Sometimes it's seen as novel foods in Europe. So there is a bit of kind of patchwork here. Another thing is that we have, legalization or decriminalization and then medical growth. So these are, again, kind of two different things to distinguish. But with this in mind, there is a central regulatory approval mechanism, EMA. If EMA approves this, then the company that has the product will file for pricing and reimbursement to each country that the company wishes to do so. And then it's up to every country to, engage in discussions and say, yes, we want this, we'll pay for this, or maybe, no, thank you. So that's one consideration. And then there is also what's called the national procedure, where one country could make a deal with a company. This only applies to certain therapeutic areas, not to neurology, but for instance, psilocybin for depression could work. So mental health conditions are eligible, or mutual recognition procedure, when one country rolled it out and then other countries say, based on your data, we like it and we would like to have this as medicine in our country. But for this, we need drug developers to first come to EMA or to a given country and have data from clinical trials. And the problem is, again, that we don't have a lot happening in terms of trials in Europe. The majority is happening outside.
Unfortunately. So if you have final comments, now would be the time. Otherwise, I think we have reached the end of our webinar. I'd like to thank Dr. Reid Robinson, Sharon Sidhu, Dr. Evan Lewis, Federico Menapace, Tadeusz Havro, Tadeusz Jubilei. Would like to thank our interpreters, the 100 and so people that participated very actively at the end of this webinar. It will be posted once we're done in English on the YouTube channel of Science for Democracy, and also the Italian interpretation and YouTube channel of di Associazione Luca Coscioni. Grazie, buonasera. Per chi ci sarà, ci vediamo a Milano sabato 21 e domenica 22. Buon proseguimento. Goodbye.